Hi everybody, this is Jill in the AAFE Training Center, and today we are going to be doing a lip enhancement. As you can see, the patient has topical numbing on, which she's had on for the last 10 or 15 minutes, and we're going to go ahead and wipe off and get going. All right, so we're going to go ahead and start Haley's lip enhancement, and now I'm going to be using a medium type filler to fill her lips. I do have it backfilled into a Botox syringe, which is a 31 gauge 8mm needle, and I used sterile technique to backfill that syringe, and I tend to like using this. It just allows for more direct, like more precise placement of product. I also think it hurts them a little bit less too, so that's what we're going to be doing, and we're just sort of going to be doing a little bit of standard volumization. I'm not going to be doing anything in terms of like going through her vermilion border. You know, certainly that could over time increase the risk of spread or migration out of the lip, and so we're just going to sort of stick with a standard volumization. She has a really beautiful normal like lip anatomy anyway. She has nice peaked cupid's bow, but you can see she's a little higher and more peaked on this side than this side. And in terms of proportion, her bottom lip is larger than the top, which is generally the case. It should be 2/3 the top lip, but it's at this point the bottom lip is quite deficient. So we're going to try and give her a little bit more balance to the lip. You open slightly for me. And you can see here I'm taking my Botox and I'm just advancing toward the cupid's bow, and I'm pushing in a retrograde fashion. I like to do fanning into the lips. It saves pokes where you know you're going to need filler anyway. And with filler, there's not a whole lot of, in terms of I can tell you how much to push. That's always the question. You're watching the lip fill. Unlike Botox, in that, you know, Botox we have to wait a couple weeks. Filler is what you see is what you get. So I'm watching to ensure that I'm getting the volume that I want. And if you feel like you need more, then certainly you can go back and give more. You can see here I'm coming a little bit vertically. I'm trying to target this area where she's a little deficient, but I'm still within the pink lip. I'm not outside my vermilion border. Best to avoid injecting into that wet dry as well. It tends to look lumpy when the patient smiles. And we just want a nice, smooth appearing lip. Here I'm just going to try and peek this cupid's bow a little bit. And you can see we did just that. Just giving her a little tiny bolus up into the cupid's bow. And I'm going to come around and do the other side. Doing okay? Mm-hmm. Making sure that you just have nice steady pressure on your plunger, so you're getting a nice sort of smooth line of product. You don't want to have it looking lumpy, and so you should have pretty consistent pressure on your plunger as you exit. The product also has lidocaine in it as well, so as I progress with her treatment, she should also start to become a little bit more numb as well. I'm gonna go ahead and administer some filler on the lower lip. I still want to, I still would like to treat the upper lip, but again, because there's lidocaine in my filler, I want to go through and just take a couple of passes, putting some filler in there, so that way she'll remain numb on the bottom. I don't want that topical to wear off before I'm heading down there. Another thing to note about her natural anatomy is she has pretty defined tubercles of the lower lip. You can see here and here. That's generally something I like to preserve if they have that. People sort of call it like lip cleavage, lip pillows, but it's generally just really pretty when you can see those pillows. They tend to look like a little bit pouty. So that's something that once I'm back to sort of perfecting the lower lip, something that I'm going to come back and sort of accentuate a little bit. Knowing your appropriate depth is really important for a couple of different reasons. Obviously, to respect the anatomy. We're trying to avoid that labial artery. And also, product injected too deep in the lip does have a greater chance for migration out of the lip. Okay, so they're looking really pretty. We're almost halfway through our syringe. Not quite yet, but just to give you a sense of how much volume she's gotten so far. All right, so now I'm gonna do a little bit in terms of defining her Cupid's bow. Again, I'm gonna stay within the pink lip. I don't wanna go outside. Perfect, so you can see we already have a little bit more balance in terms of the ratio from the top to the bottom. I am gonna go back and put a little bit more in the bottom, but you can see even just the small amount that I added, how it hydrated her lip. The hyaluronic acid is going to hydrate the lip. So if you ever have a patient that comes in and says like, well, I love my bottom lip, I don't really want anything done there. Just make sure that you're educating them about the need to at least put a little bit in there. So that way, you know, her bottom lip doesn't look sort of shriveled, and then the top appears like nice and smooth and shiny from the hydration that we get with the AHA product. So in wanting to accentuate these pillows, my approach is just going to be a little bit different. Again, still staying within the pink lip, but coming up and pulling down just to accentuate that down a little bit. I want to sort of give her more of that pout. Turn towards me a little bit. Thank you. Okay, so now I'm just sort of looking for symmetry, assessing if there's any areas that need me to go back to. Always clean them up, makes it a little bit easier to see. But look how pretty those look. Of course, she's got little tiny bruises. Here's a bruise. Bruising and swelling is totally normal. How many times did I just poke her with a needle? So make sure you're telling your patients to expect that. It will resolve. Lumpy bumpy is sort of a normal sensation for them to feel over the next 2 weeks, I would say. After 2 weeks, everything really has the opportunity to settle. And by that time, they'll just love the results. So I'm gonna roll her out. The reason we do this is just to make sure everything feels nice and smooth. You don't want any like lumps of material. Of course, she's gonna get some swelling, which will feel like lumpy. It's just at that point, it's soft tissue swelling. So I'm just making sure that there's no like firm deposits of filler that need to be straight. Everything feels really good. So that's what we've got.